you need a kind of a strengthening exercise for all of the shoulder girdle and also all of the back muscles such as the latissimus dorsi, and somehow without the power of these exercises, these muscles, you cannot do this situation for this exercise. And for the aerobic exercise, any suggestion, any idea for the aerobic exercise, for the time you need aerobic exercise? What is that? Guitar. What did you say, sorry? Guitar, what is the meaning of guitar?
Yes, mean one line.
Okay. Okay. So what did you say about the
use device like
aerobic exercise? Can be another. What is the reason we want to use aerobic exercise? When we are trying to use aerobic exercise, you do read it through the exercise. What is the main reason of aerobic? You know the meaning of aerobic exercise?
No.
No? Aerobic exercise. Any idea about aerobic exercise? No idea? For increasing the power or coordination of cardiovascular respiratory. So it's a kind of general type of exercise, bring you better coordination on cardiovascular and respiratory system. Okay, so it's a kind of a strengthening, it's a kind of powerful, yes. For? I didn't get it, sorry. Core? Okay. Core is something related to much powerful system of probably back or any other of the part of the body. The aerobic exercise, it's a kind of, I know you are a little tired. You are too actually soon, you came too soon. That is the reason you are tired. Okay. Aerobic exercise is not the kind of, how can I say, main exercise. You are using the aerobic exercise close and with the other exercise. You are using a strengthening exercise, a stretching exercise, coordination exercise. You are using, for instance, plyometric exercise, functional exercise. At the same time, you are using aerobic exercise at the same time. Why? Because you are trying to increase level of cardiorespiratory coordination. What is the example of aerobic exercise? Just medium running in an area with full of oxygen in a park, or cycling. You want to try to coordinate actually the cardiovascular and respiratory system. Something else, aerobic exercise, something else. Running in treadmill. Can you increase tension of aerobic exercise when you are running in treadmill in the gym? Like? Can you change it in the treadmill? Yes. Change the slope. Change the slope. Or something else. You said climbing. We have a stepper. in a gym, you can see there is something that there is a kind of similar action like mountain climbing.
To exercise.
A stepper, we call it a stepper.
Cycling.
It's not cycling, a stepper. A stepper like you're climbing something. You can write it on the Google and see the picture of stepper. Okay, so they are all aerobic exercise. Okay, when you want to use it, middle and later stage. In the earlier stage, no, because you are just in initial step. But in the middle stage or later stage, you can try with it. Stepper. Cycling. Trade me. I think I forgot to find a stepper actually picture. I will add it. I will add it right now and see. Stepper. Okay, proprioceptive neuromuscular facilitation exercise. You know that. The one explaining. You know that. You know that. PNF. You know that. Give me some example of PNF.
Rhythmic stabilization.
Good. Another one, which is very actually popular in your job.
Hold the legs.
Hold the legs. I think that in every day in the clinic, you are using hold the legs. Whenever you will be in a clinic, you have to use a hold the legs. It's magnificent actually approach for the increasing range of some joints such as actually knee or probably hip or probably shoulder or something. Every time you are using hold relax. What about elbow? Is it good to use a hold relax? Might be, but what is the point? What is the concept? What is unique in elbow? Your prof didn't tell you last semester. Your prof was me. I told you. I did tell you. Pura said wants to say that. No.
Elbow.
What is the point about elbow? When you want to use a hold relax for knee, it's easy for the ankle, for the hip, for the shoulder. What is the critical point in elbow? What is the difference in elbow? I mean, it's not very easy to use a hold relax in elbow. Why? It's not very easy to use hold relax for elbow. Why? What is unique in elbow? Come on. Push it more. What is unique in common elbow? Type of the joint. What is the type of this joint?
Synovial joint. It's skull and ball.
Is it sandal joint? Is it condyloid joint? Is it ball and socket? Is it ball and socket?
Yes. Concave and convex.
It's similar to that joint. Exactly this joint is like that joint. How many type of joints? Condyloid like knee. Okay. Ball and socket.
Hip.
Ball and socket. What is type of this joint? Come on. You are physio. Come on. You must answer me with closed eyes. Very easy and fast. Hinge. It's a hinge joint. Do you have a booklet or something? May I have your booklet, please? Just once. One second. What is happening for hinge joint? If you have a problem in hinge joint, what is happening? The joint will be destroyed. But in condyloid joint, you have way to escape. In condylar joint, it's not that one is hinge. Condylar joint, you can change something else. In hinge joint, you have just one direction, one freedom, one degree of freedom. Ura, are you with us?
Yes.
It's just one degree of freedom. Flexion, extension. Condylar, rotation, flexion, extension. Ball and socket. How many degree of freedom for ball and socket?
It's a pretty.
Flexion, extension, adduction, abduction, internal rotation, external rotation, whole of them circumduction. 3 degree of freedom, 3 direction. Okay, in hinge joint, just one direction, 1 degree of freedom, flexion, extension. Because of the situation, if you have a problem in hinge joint, actually they make a kind of limitation for the joint. If you force it, they destroy the joint. Why? They stimulate the joint to provide extra abnormal bone. We call it, I'm not sure, did I say it to you or not? We call it HO, heterotropic ossification. I think I told you. Heterotropic ossification. Extra bone formation, extra exercise. Okay, extra bone formation, what does that mean? Limitation for the movement. So, if you force it and provide any kind of problem in here, you will have heterotropic ossification, extraordinary ossification. What does that mean? Much limitation. This is the point. How many pure hinge joint does we have? Pure hinge joint. Just fingers, IP, PIP, DIP, just fingers. What about MP? Condylar. Flexion, extension, adduction, abduction. Condylar. Just PIP and DIP is hinge and elbow. Just it. But PIP and DIP is not too worried about that. So because they are not a high responsibility, they doesn't have any high responsibility. Here we do have high responsibility. Okay. So in P and F you have a relation in Golgi tendon relaxation and autogenic inhibition. This is referred to the exercise therapy. Or you read it. There's a kind of limitation, there's a kind of actually relaxation. And so as a result, you can move further, you can provide better movement, such as hold, relax, or contract, relax, anything else. Rhythmic stabilization, rhythmic initiation, or name of the technique, you learn it. Okay, proprioceptive facilitation exercise. You have four actually diagonal movement.
Yes.
D1, D2. Such a kind of D1, D2. They are mostly using this diagonal actually pattern. Mostly used for the hemi patients. You have the neurology, hemi patients. Okay. Oh, stretching, your magnificent actually preference, stretching. Why we need a stretching? The shortening, stretching, not a stretching.
To remove the contraction in the muscle.
Yes, they are contracted, yes. But why we need the whole range? Why we need it? I told you. Why? You want to make it in the highest amount of the power. So, if you have a shortened muscle, you can't bring it to the highest power.
Yes.
You must take it to the normal length and then use all of the motor point to bring it to the highest amount of the power. If you have a kind of 30 degree, 50 degrees, so it's not possible to activate all of the motor points, is it? Okay, so you need whole of the range. So imagine, this is not actually on your age, probably you don't have any idea because it's a general approach. About 30 years ago, 35 years ago, something like that, a young period of my life, there was a country named Democratic DDP, I mean Eastern Germany. DDP, what is that one? It is part of the Eastern actually area of world under supervision Soviet Union or something like that. I forget the whole of the term of the country. It was democratic Eastern Germany or something like that. But after about 15 years something, in 1989, the wall of Berlin was destroyed and these two parts of Germany catch together again. But up to that time, there are two different countries. They started to work on the young boy and girls from the age of 4 or 5, and they did the same in the Soviet Union as well, former Soviet Union. Why? Because they wanted to provide everything in a kind of actually scientific way. They work on these people and these young ladies, boys and girls, to make them to highest amount of the power, for instance, in 14, 15, something like that. And they are always would be in the second rank or third rank of Olympic Games. Why? Just because they are following scientific rules. And why it was not a good approach? Because they forced the young boys and girls to move just in some specific way. They lost the other approach, the other aspects of their life. For instance, playing as a child, something like that. And that was the reason they condemned by somebody else. After they destroyed, I mean the country that was destroyed, this method can be vanished. But they started from very young, old age old, 4 or 5, something like that. Just practice, do it in the highest amount of the length of the muscle, and they drew all of the gold medals, for instance, in swimming, for instance, in gymnastics, just in very young ages, 14, 15. Have a look to the list of the medals, to the, for instance, 1980 Olympic, Moscow, 1984, Los Angeles, not Los Angeles because of some political issue, 1976, Montreal, Canada. I mean, when you need these kind of methods, this kind of approach, you can use it for treatment as well. Okay.